Hi, I'm Dr. Stan Tretter, Chief Medical Officer at Memorial Hospital and Healthcare Center.
Hi, I'm Dr. Christopher Bunce. I'm an infectious disease specialist here at Memorial Health Center.
As this pandemic has continued, we've obviously seen lots of ups and downs, both nationally as well as locally. Since this pandemic began in our area in March, we have steadily seen a slight increase in numbers over the first few months, but over the last month, we've really seen an increased number of cases out in our community. Many of these people are asymptomatic or mildly symptomatic, but some of them are sick enough to require hospitalization as well. So we are seeing increasing numbers in our community.
And I would add that would reflect the general trend across the state, maybe a little bit more here right now, as well as the rest of the country. We are seeing increased rates of COVID in different regions. It's not hitting simultaneously everywhere. It sort of hits a wave one place and then moves to another. The Midwest is seeing a bit of a surge right now. And so what happens around the state of Indiana and around Du Bois County is very important. We have to pay attention to that as well. Well, I think what we know now is we know more about transmission. We have more data about what the risk factors are for transmission, how the preventative measures work, how they reduce the risk of transmission. We certainly know more about masking. Obviously, in the beginning, we were focusing on personal protective equipment for people who are actually taking care of inpatient COVID patients. Now we realize more that the virus can be transmitted by pre-symptomatic or asymptomatic people, that if you have a mild infection, it doesn't mean you can't be a super spreader. You could spread the virus significantly. We know that. We didn't know that in the beginning. So we have learned a lot about transmission and measures that we can take to control transmission. Unfortunately, one of the problems has been compliance and getting people to really understand how important it is to take measures even when you feel well.
Patients who are having symptoms of COVID-19, which can include anything from fever, cough, shortness of breath, also GI symptoms such as nausea, vomiting, diarrhea, or abdominal pain, sometimes sore throat, loss of smell or taste, muscle aches or fatigue, really a wide variety of symptoms. But if you're having symptoms that you suspect might be COVID related, particularly if you've been around or exposed to people who have had COVID, then certainly we would recommend that you receive care. Your options here at Memorial Hospital are either to go to our urgent care center in Huntingburg or to the emergency department if you're sick enough that you feel that's the appropriate place for you to go. And at either place you'll be evaluated by a provider and can have testing done. Also, our physicians and providers on staff can order a test for an individual. So if you call them, they may have you come to their office, or they may talk to you via telemedicine or on the phone, and they may feel that you require a test, and they can order a test for you to have done as well. For people who are asymptomatic, which means they're not having symptoms of COVID-19 but feel they need a test, maybe they've been exposed to somebody or fear they've been exposed to somebody, they do have the option to go to the Indiana State Department of Health OptumServe testing site, which is located here in Jasper on Clay Street.
I'd like to add 2 points to that, actually. It's important to understand that if you've been exposed to somebody and you do get a test, and that test is negative, it doesn't mean that you didn't contract the virus. It's really important to know that there's an incubation period in your body before which we will not detect the virus. And then you start shedding the virus and you don't know it, and then you develop symptoms. So if you've had an exposure, running out and getting a test isn't necessarily the best thing to do, because you will just as easily may have missed the virus up front. Secondly, if you have symptoms, if you are ill and you go and you get a test and the test is negative, you still have to stay home and take care of yourself until you're completely better, because the test does have a false negative rate. It is possible to have COVID, have a test, and have a negative test. And if you're ill, you should act as though you have it and stay at home and follow, your own isolation guidelines. That's really important, particularly in the midst what we're seeing here is a little a mini surge here in the county. That's a very good question. Once you're positive, you don't need to be retested, okay? Except under very special circumstances. But for the vast majority of people, when you're positive, and then you have to go into isolation, and then you come out, and you come out. If you have symptoms, you have to, and you have mild disease, you have to be in isolation for at least 10 days and have at least 24 hours without a fever and improving symptoms. That's pretty simple, straightforward. What we've learned is that the virus goes away in terms of the amount of virus that you shed goes down fairly soon after the onset of symptoms, gradually until about 6 or 7 days. And then most people by 10 either aren't shedding virus anymore, and if they are test positive even after 10 days, they're not shedding viable or transmissible virus. So we do not recommend retesting anyone for COVID within 3 months of their original test, because we know that in certain people they can shed particles of DNA that can be detected, but that is not transmissible. So it's real important. That's why we have these 10-day guidelines.
I think that's a very good question as well. Obviously, there's lots and lots of information that's out there, whether it's on social media, on the internet, gossip between neighbors. You hear lots of information. So really it's important to go to really trusted places for your information. Places like the CDC, the Indiana State Department of Health website provides good information. And certainly your local health department or your local healthcare provider can provide information as well. On our website we have lots of good information as well as links to other trusted sites that you can go to.
I think it depends on the level of compliance, obviously, and it depends on the level of compliance not only with individuals but businesses and other places. You know, if there's a mask mandate and you go into a Walmart and nobody's enforcing it or nobody's paying attention, there's then I would say that it's not going to work. But I think that if we can get 80–90% of people to wear masks and do it consistently, I think we're going to start seeing it within the next few weeks, a month or so, that we're going to start seeing some trends downward. Obviously there are people, there's an incubation period is up to 14 days, so there is going to be a delay with any intervention.
So many of the guidelines have not really changed and are the same guidelines that we've been really instructing people to do all along. Things such as washing your hands or using hand sanitizer frequently, social distancing, meaning keeping yourselves away from other people at least 6 feet in public, wear masks or other face coverings when you are in public, avoid large gatherings of people when possible, and really stick to good hygiene both at home as well as when you're out and about. And those are the things that we continue to encourage people to do as a community. Certainly at our healthcare organization we take many precautions to keep our patients and our staff safe, and we have been continuing to do that for the last number of months in order to do that. Certainly I think what we have to look at is, as we see increasing number of cases in our community, the reason for a lot of that is because we've become a little lax in some of those things. As we encourage people or allow people to get out and socialize a little bit more, I think people have taken liberties and gathered in ways that may have led to more viral transmission. And so we need to constantly be wary of those kind of situations so that we can protect ourselves and avoid that type of transmission. Certainly it's very important for people to continue to receive the health care that they need. At Memorial Hospital and Healthcare Center, as well as at all of our offices and clinics that we operate, we take great precautions to keep our patients and our staff safe. It is a very safe environment, and we encourage people to come in for the care that they need. I think there's much more greater risk for people who delay or withhold their care, thinking that they're scared to come to the hospital or come to their doctor's office, and they really put themselves at risk by not receiving the care that they need. Certainly, again, we take precautions. We have mask wearing as a requirement in any of our facilities, and we ask that visitors and patients wear those as they come in, but we do take many efforts to keep you safe as you're receiving the care that you need.
Yeah, I would have to agree with that. One of the benefits of the lockdown is that it gave us a little time to figure out how to do things and how to do them well. And I think hospitals across the country, including Memorial, have done an excellent job of learning those lessons and implementing the measures that are necessary for safety. So I feel confident in recommending hospital care for those who need it. And I'm very concerned about people who don't go in for needed services when out of fear of COVID-19. Believe me, there's a lot more that you can do that would be higher risk for COVID than go to your hospital or your doctor's office. It's a very good question. What can families do? And I think there's got to be communication in the family. You have to talk to, obviously the young people in the family. They have to be careful about their socializing. It has to be an ongoing discussion. Because families they're a unit. I mean, families tend not to mask, they're in the house together. They're all close contacts if somebody gets COVID. So they're all sort of, they're all sort of roped together in this. And I think it's real important that especially young people who tend to want to socialize a lot really respond to this and take the necessary precautions so they don't come home and infect their siblings or their parents or, their older and more vulnerable relatives. It's real important. It has to be an ongoing discussion. Also, when you go out or you do things as a family, take precautions together. Always make it a topic of conversation. Reinforce the masking message, okay? It's really important. There's a lot of anti-masking, I would say, propaganda out there now, and masks are not in any way harmful. They've been shown again and again to be helpful. And so reinforce that with younger kids and certainly adolescents. Everybody has to wear a mask when they go out, and they're going to be close to anyone else who's not in the family. Getting back to a new normal, obviously it's not the old normal, but you have to just adapt. And sometimes it's good to look historically at what people did in hard times. And that's the way I look at it. It's motivation. My mother used to tell me what she did during World War II and how she had to go collect rubber and all this, and everybody was pitching in. And I think if we look at it that way, we can kind of get beyond it as a burden and look at it more as a responsibility. And also, there's going to be a light at the end of the tunnel. We're not going to be wearing masks everywhere, from here to Kingdom Come. COVID, it may be forever, like the flu is forever, but I have a feeling that we're going to be dealing with it either through vaccination or other means, that we're going to kind of shift back to our old normal to some degree. Certainly not, we're not going to be wearing masks forever, but during this period, until we have a means to protect the vulnerable populations, I really think that you just have to adapt, and adaptation is everything. And then the attitude has to be can do. It can't be, oh, I just don't want to do this. I can't do this. I can't stand this. I mean, that's kind of a negative attitude. Having a positive attitude about the things we have to do is extremely important.
Certainly returning to school is a complex issue. We know that school is important for not only education but also social development of children. And certainly everybody understands that and wants to see schools open and children back in school. However, we have to balance that with the risks involved. We know that getting people together in indoor facilities is a risk of spreading the virus, and so we have to be very cautious about how we approach that. And so all the precautions that have been put in place, certainly our school administrators and our local healthcare officials have spent numerous hours putting together plans to try to make the schools as safe as possible, understanding that there's no place that's 100% safe. We understand that, and we have to balance those risks. But things such as wearing masks and hand sanitizing and keeping your distance from each other, those are going to be things that are difficult for children to understand and to learn to do. So I think parents really need to take the first role in trying to explain that to their children, help them understand why we're doing what we're doing, don't make them afraid to go to school, but understand really how they can protect themselves with these types of things. Once they get to school, there'll be new rules that kids are not used to, and they're going to have to learn those new rules and work with their teachers and their peers to hopefully follow them. But again, as parents, we're the primary role model, and we have to have a positive attitude and a proper approach to support our teachers and the schools in these new rules as we send our kids back to school.
I totally agree with everything that Dr. Tretter said. I would also add that parents need to be supportive of school administrators and teachers to the point with an understanding that this is unprecedented, that we're trying to open schools in a pandemic, and that there are going to be missteps. I don't think anyone's going to get it completely right, even with all the preparation we've put into it. And that we're going to have to stop, take a step back, we're going to have to come up with plan Bs at times, and that it's important to support the schools in their efforts to make adjustments and not just criticize them because you don't like it. I mean, because a lot of things that schools are going to ask of parents and families, your first initial response would be, well, I don't want to do that, or that's a burden. But keep in mind that there are a lot of people working really hard both to get kids back to school and to make it safe, but they don't have a lot to go on because we haven't done it before. Probably the most important development in treatment is the use of steroids for people who have severe illness who go to the hospital with low oxygen levels. I think that the studies have demonstrated some significant efficacy in both saving lives and shortening hospital courses. So be that as it may, we don't have a specific drug yet that is approved to treat COVID. The hydroxychloroquine that was used earlier has not been shown to have efficacy in a number of controlled randomized studies. So I think that is no longer recommended, and it is so that's an important message to gather. There's still some lingering belief that that's the drug, but it really isn't. It doesn't help prevent it, and it doesn't help treat it. We have data for both of those things. We do have other drugs like remdesivir, which is an experimental drug. It is being released. It's been used here at Memorial. It's been used, but it's very limited in supply, and the final clinical data isn't out. We have enough to think that it's fairly safe and that it does have some efficacy, but we don't know exactly how to best use it yet, and we tend to use it in the most severely ill patients. I think overall, vaccination is going to be our biggest hope, okay? We would rather prevent infection than have to react to it all the time. And so I'm thinking that hopefully by the first quarter of 2021, we'll have a vaccine. I know there are rumors that it's going to happen before then, but I'm trying to be a little more conservative. I think if we get it out in the first quarter of 2021, it would still be a remarkable feat, unprecedented actually. And we have to make sure it's safe and effective, and that rushing it or incentivizing it hasn't compromised that at all. And I think as long as we follow the regular guidelines for research and development of drugs, and we have proper oversight, which we do, we're gonna come up with something. I think we will.
And I think as we wait for our scientists and medical professionals to develop treatments and vaccinations and all the work that's being done, really our part as the general public is really to do our part to slow the spread of the virus now. And again, we can do that with the same types of precautions that we've been discussing all along. And really that's our responsibility as a population, to really keep the viral transmission down as low as we possibly can as we wait for these medical developments to assist us in really helping us to turn the tide of this pandemic.